Have you ever forgotten someone's name or where you parked your car? What if those moments of forgetfulness never went away? In this video, we're going to explore Alzheimer's disease, a progressive neurological condition that affects millions of people worldwide. Alzheimer's disease is a type of dementia that affects your memory, your thinking, and your behaviour. It's the most common cause of dementia among older adults, and its risk increases with age. In the UK, it's estimated that 1 in 14 people over the ages of 65 will get Alzheimer's, and 1 in 6 people over the age of 80. However, 1 in every 20 people with Alzheimer's are under the age of 65. This is known as early onset Alzheimer's. In this video, we're going to dive into the causes, the pathophysiology, the symptoms and risk factors, diagnosis and treatment for Alzheimer's. So what causes Alzheimer's disease? Alzheimer's disease is caused by a complex interplay of genetic, environmental and lifestyle factors, and is associated with the accumulation of 2 types of protein deposits in the brain: beta amyloid plaques and tau protein tangles. In basic terms, these cause brain cell death and shrinking of brain tissue, leading to memory loss and other Alzheimer's symptoms. So how do you get a diagnosis? Diagnosing Alzheimer's can be really difficult because its symptoms are so similar to other types of dementia. There is no single test for dementia. A diagnosis is based on a combination of different assessments and tests, which can include the following. Number 1, medical history. Doctors will take a comprehensive history of symptoms, past medical history, and review your medications. Number 2, cognitive tests. You may be required to do mental ability tests, and although these tests cannot diagnose Alzheimer's, they may show there are memory difficulties that need further investigation. These tests assess a number of different mental abilities, including short and long-term memory, concentration and attention span, language and communication skills, and awareness of time and place. Number 3, blood tests. Your GP will arrange blood tests to help exclude other causes of symptoms that can be confused with Alzheimer's. Number 4, brain scans. Scans such as MRI may be done to check for evidence of other possible diseases. An MRI will help to confirm a diagnosis of dementia and the type of disease causing the dementia, for example, Alzheimer's disease. It can also provide detailed information about the blood vessel damage that can occur in different types of dementia, and it can show shrinkage in specific areas of the brain. If results are uncertain, some doctors may recommend a PET scan, which looks at how the brain functions and can pick up abnormalities within the blood flow in the brain. So what are the risk factors? Although it's still unknown what triggers Alzheimer's disease, there are a number of factors known that can increase your risk of developing the disease. The most significant is age. The likelihood of developing Alzheimer's disease doubles every 5 years after you reach 65. Other risk factors include family history, and there are various gene variants that can put you at higher risk of developing the disease. Another risk factor includes Down syndrome. People with Down syndrome are at higher risk of developing Alzheimer's because the genetic changes that cause Downs can also cause amyloid plaques to build up in the brain over time, which can lead to Alzheimer's. Other risk factors include head injuries and lifestyle factors associated with cardiovascular disease, such as smoking, obesity, diabetes, high blood pressure, and high cholesterol. So what are the symptoms? The symptoms of Alzheimer's develop slowly over several years. Sometimes these symptoms are confused with other conditions or put down to older age. Generally, the symptoms are divided into 3 main stages: early stages, mid stages, and late stages. In the early stages, the main symptom that you'll see are memory lapses, but you may see someone also experience the following: forgetting about recent conversations or events, or misplacing items. They may forget the names of places and objects, or have trouble thinking of the right word, or they may even ask questions repetitively. Someone may also show poor judgment or find it harder to make decisions, and they may become less flexible and more hesitant to try new things. There are often signs of mood changes, such as increasing anxiety or agitation, or periods of confusion. As Alzheimer's progresses to the middle stage, some of the symptoms will get worse, including memory lapses. Someone with a condition may find it increasingly difficult to remember the names of people around them, and this can be a particularly distressing symptom for loved ones. Other symptoms may also develop, such as increasing confusion and disorientation, for example, getting lost or wandering and not knowing what time of day it is. Someone may also show obsessive, repetitive, or impulsive behaviour and develop delusions, which is believing things that are untrue. They may also feel paranoid and suspicious about carers or family members and have disturbed sleep. People may also develop problems with speech or language called aphasia, and there may be changes in mood, such as frequent mood swings, depression, and feeling increasingly anxious, frustrated, or agitated. Someone may have difficulties performing spatial tasks, such as judging distances, or they may see or hear things that other people do not, called hallucinations. By this stage, someone with Alzheimer's may require some help at home, including support with washing and dressing, or using the kitchen, or using the toilet. In the later stages of the disease, the symptoms do become much more severe, and of course this is really distressing for the patient and their families. Hallucinations and delusions may come and go over the disease progress, but in the later stages these symptoms do tend to get a lot worse. Sadly, some people can become violent or increasingly suspicious or demanding of those people around them. A number of other symptoms that can develop include difficulty eating and swallowing, called dysphagia, difficulty changing position or moving around without assistance. Someone may also have severe weight loss or an unintentional passing of urine, called urinary incontinence, or stools, which is called bowel incontinence. In the severe stages of Alzheimer's disease, someone may need help with all of their aspects of daily living, including moving around, all of their personal hygiene tasks, and toileting. So what is the treatment? Whilst there is no cure for Alzheimer's disease, there are a number of treatments available to help manage the symptoms and improve your quality of life. Lifestyle factors such as regular exercise, following a healthy diet, and regular social engagement can also help to manage the symptoms longer term. The main medications utilised to help improve symptoms temporarily include acetylcholinesterase inhibitors. These drugs increase levels of acetylcholine, a substance in the brain that helps nerve cells communicate with each other. The second is memantine. This drug works by blocking the effects of a brain chemical called glutamate. Glutamate is often present in higher levels in someone with Alzheimer's, causing brain cell damage. In later stages of Alzheimer's, people may also develop worsening behavioural and psychological symptoms that cannot be managed with coping strategies alone. Therefore, antipsychotic medications may be considered. There are a multitude of non-pharmacological therapies and activities too, including cognitive rehabilitation, reminiscence therapy, which involves talking about things from your past, and general quality of life activities for families. So in conclusion, Alzheimer's disease is a really complex decision that has a huge impact on patients and their families. Whilst there is no cure, there are a number of therapies available to help manage your symptoms and improve your quality of life. We hope that you found this information helpful, and we'll see you next time.